The next one, syphilis. So we know only one thing: syphilis means destruction. That's it, right? Let us see what Hahneman writes. So let us see what Hahneman writes. Primary syphilis. I want you to read this. I'm not going to read it. If you can read. Okay. Okay. So Shankar, this is just how syphilis is contacted, and when you contact syphilis, this is how it moves ahead. Just the uh, pathophysiology. Then there is secondary syphilis. All these things you will get on Google, right? You'll get on other books. This is very important now. Look at this. Secondary syphilis. So look at what are the areas that has been affected. Mucous membranes, lymph nodes, maculopapular or pustular non-itchy rash, fever, sore throat, malaise, weight loss, hair loss, headache. Oh my God, can you imagine this? These are symptoms of syphilis, and you're saying destruction. Weight loss, hair loss, malaise, fever, even headaches, chronic migraine headaches could be a feature of syphilis. You don't know. And then he says, rare manifestations include hepatitis, kidney disease, arthritis, periostitis, optic neuritis, uveitis, interstitial keratitis. And he says it is rare manifestations of syphilis. Isn't it something different? Right? Let's go ahead. Let's come to the tertiary part, tertiary syphilis. And it says tertiary syphilis, you will find cardiovascular stroke, CVA, dementia, loss of coordination, numbness, paralysis, blindness, deafness, heart disease. Okay, sorry. I want you to look at this slide very carefully. Maybe because of blindness, deafness, those people said it is destructive. But Hahneman says, no, don't go to the word destructive, but look at the pattern. Now if I get a case where I see a patient who has got a lot of past history in his family, a lot of people died with heart attack or they died with stroke. What should I think now? That he is a carrier of syphilitic probability. Even paralysis. So in a family, if I find out in family history or even some personal histories, a patient comes to me and says, this guy has got CVA and also heart attack, or he has got multiple heart attacks and he has got history of heart attacks. Maybe it is syphilis. I just remember one friend's case, I just let me discuss it. This was in very old case actually, and that time I was learning homeopathy. I was a student, and I met one of my friend, and his sister's husband had died with heart attack. He was a very young guy, maybe 30 to 30 years of age. He just died. One day he woke up, he got massive heart attack. He fell down in the morning and collapsed. So what they were discussing and what I remember at that time is that in his entire family, his father, grandfather, uncles, brother, everybody has died with heart attacks. And they were knowing this fact that in family, this is what the trouble is there. But they were taking some allopathic medicines. They were visiting cardiologists properly. So investigation, everything was done because they were very careful. But still, one day he woke up and he collapsed. Now I remember, now I understand that thing, that person's case. Maybe Maybe syphilis was the thing that was there predominant or hereditary in his family. So if now I get a patient like that, the first thing I'll think is antisyphilitic remedies, or as an anti-miasmatic, antisyphilitic drugs I have to give. I hope you're understanding the fact. Say yes, no. Good. So now I will look at these features, and if these features are available, my mind will go to syphilis. Let's come to the congenital, and then he says congenital syphilis. In congenital syphilis, he says hepatosplenomegaly, rash, fever, neurosyphilis, syphilitic meningitis, general paresis, Tape's dorsalis, many things, many pneumonitis, saddle nose, right? Saddle nose. You know what is saddle nose? Have you seen patient with saddle nose? Right? That is a very strong feature of syphilis. This is what is being seen, that congenital syphilis has got these physical manifestations. So if you see a child who is having saddle nose, right? Maybe antisyphilitic drugs should come in picture, and you have to think about those drugs. Let's go ahead and see more about syphilis from chronic disease. He says pricking painful ulcers of tonsil. Somebody said ulcer means syphilis. No, no, no. Sorry. What kind of ulcer? Ulcer can be psoriatic, ulcer can be psychotic, ulcer can be syphilis. He says pricking painful ulcers of tonsils. Somebody comes to you with tonsillitis, 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 and he keeps on telling there is a pricking pain, something, always pricking, pricking, pricking. Maybe it could be you need an antisyphilitic drug. Round copper colored spots that shimmer through the epidermis. Okay. I'm just reading some of the sentences. Eruptive pimples. Now see, pimples. Pimples is not destructive disease. Okay, nobody dies with pimples. So even pimples can be a syphilis manifestation. But there is a characteristic to it. Eruptive pimples which do not itch are found chiefly on the face upon bluish red foundations. I have not seen any bluish red foundation pimples yet, so I don't know how it actually looks. But now I have in my mind that a lot of patients come with pimples, 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 and non-itchy pimples. Maybe I will write it down somewhere for syphilis. Painful cutaneous ulcers of scalp. Painful ulcers. Penis, which are smooth, pale, clean, merely covered with mucus, almost at the level of healthy skin. The remedy that comes in my mind after reading this sentence is, mesarium. Have you read mesarium? In a way, scabs, then ulcers, then scabs. The description of that remedy comes in my mind. That is actually syphilis. And then of course boring nightly pains in exostosis, curly hair as well. Yeah, ulcers below the scabs. Generally we think of mesarium. These are all syphilitic manifestations. And nightly pain, of course, that syphilis means night aggravates. The patient is better all day, but in the night he gets aggravated. The pain starts, the ache starts, the fever starts. And exostosis, you'll see exostosis. In exostosis, lot of antisyphilitic remedies you'll find. Okay, so we are finished with syphilis actually. Now, okay, does it make sense what we are talking about? Right, there could be more manifestations also. I have not written everything. We have just taken few most important points and written, but there could be more things, right? So hence you have to read this. You have to read this. So now what I do is that I keep these things in my mind. This PPT is there always in my laptop, and I keep on reviewing it. Hence, now in my practice, of course, the case taking is very important part. Repertory is very important part. But in the case taking, past history and present history, the past history and family history becomes very, very, very important part of my practice. Where did I learn this? I learned this from Burnett's theories. You know, J.C. Crompton Burnett. J.C. Crompton Burnett was one of the physicians, one of the pioneers of homeopathy, who actually who actually published his cured cases. And I do not know any other homeopaths who have published their cases. You cannot find Clark cases, Hahneman cases, Herring's cases. And he boldly he published his cases. He had written so many books on tumors, breast, sterility, vaccinosis, lot of books he has written. So if you are really interested to know how to deal with bad cases, pathological cases, I would suggest that go and read J.C. Crompton Burnett's the first book, Tumors. Once you start reading the book Tumors, I don't know how much you will understand because he has not explained everything. But if you read diligently and completely it, you will understand that he was a person. He was a person who actually looked into the past and the family history, and he gave immense what do you say, immense importance to it. Let me share you a case and then we will move ahead so that we have some more understanding about it. Okay. Ringworm. Ringworm. A lot of patients get ringworm. You also must be getting a lot of patients to ringworm. Now you tell me which is the drug that you give to ringworm patients. There is one specific drug. There is one specific intercurrent drug rather, which is given for ringworm patients. Oh, Basilinum. It came. I was waiting for that. Basilinum. Yeah, there are many tellurium, but Basilinum is one of the remedy. Basilinum is one of the intercurrents that any ringworm patient comes, any fungal patient comes, we give it. You know why? You know why? Anybody knows the reason? Maybe you can write it down. No, nobody knows. Okay. So let me tell you this story and then it will help you to understand syphilitic miasm. No. So let me tell you the story and then you will really understand why bacillum is always said to be a specific for ringworm. And the person who is being blamed for this is J.C. Compton Burnett. Because Burnett was the person who has written a small booklet called Ringworm. Ringworm in homeopathy. Yes, Burnett. And Burnett has given many cases of ringworm in his time and fungal diseases which he could cure with basilinum. So learning from him, a lot of homeopaths give basilinum, and when it does not work, and let me tell you, in 50-60% patient it does not work. Generally in India it works many times, and I'll also tell you why in India works, but still there are 50-60 patients it does not work. And then people start criticizing, oh, these specifics are not good. Oh, this Burnett is stupid. He wrote some wrong things. But let me tell you how he came to but people don't read why he started giving basilinum in ringworm cases. So let me tell you what happened. As Burnett was a person who was treating a lot of bad cases, he was getting a lot of ringworm patients, and he was trying a lot of remedies. He could not succeed. And then somehow, in one of the patient, he went back, past history, family history, and then he noticed that this patient has got past history or rather family history of tuberculosis. What? Tuberculosis, phthisis. And in many patients of ringworm, he found that patients are coming with a lot of past history of tuberculosis. Hence, he thought of giving basilinum. Now, don't ask me what is the difference between tuberculin and basilinum. We can talk later on. I'm just telling you what happened. So, hence he started giving basilinum to all ringworm patients, and his patients started getting better and better and better. And hence he published so many cases of ringworm cured with basilinum. But the secret is not ringworm equals to basilinum. The secret is ringworm with the past history of tuberculosis, basilinum. Are you getting my point? Say yes, no. Yeah. Now you understood what happened, how these people used to practice. So he was not interested in the ringworm. He was interested in the past history, the family history. And from there he deduced, and he said, maybe this is the another intercurrent or anti-miasmatic remedy that I need to give. So now, why I started saying this? Okay, yeah, past history and family history. Okay, so that's how. Okay, now in India, why we get result with basilinum in fungal cases? Can somebody say? Can somebody answer this? Why do we get so many results in? There are a lot of patients who get better with ringworm fungal. Of course, partially BCG, TB, very good. So tuberculosis is very, very, very prominent in India. Everybody carries. I am also a carrier of tubercular bacillus bacteria. I'm also a carrier, isn't it? Hence, basilinum works in India. BCG. Every child who comes out of the womb, the first thing they give is BCG. So we all have tubercular bacilli. Are you getting my point? So we are a carrier, in a way, and hence basilinum works. So now we come to the point that treating miasmatic drugs or miasmatic symptoms or intercurrent, whatever you call block and this and that, you have to focus on past history and family history. So you go back, you go back, you go back, you look at the past history, look at the family history, look at all the diseases he has suffered. That will actually give you the understanding of which intercurrent actually is needed. And of course, the present predominant symptom also, but mostly these past and family histories will help. Shall I go ahead? Are you clear? Are you able to understand what I'm saying? Please say yes, no. Okay, good. So now we come to the most important